Welcome to our podcast, When Life Gives You Lemons. I'm Kevin.
And I'm Palmy. We consider ourselves disability advocates and intend to spotlight some disability issues and things we find interesting that we frequently encounter when we're out and about. Also, some history on disability that we find interesting.
Hello, everybody, and welcome to our podcast, When Life Gives You Lemons. I'm Kevin.
I'm Palmy.
And this week we're going to talk for a little bit about amyotrophic lateral sclerosis, otherwise known as ALS, otherwise known as Lou Gehrig's disease.
Which is a progressive neurodegenerative disorder that affects nerve cells in the brain and spinal cord responsible for controlling voluntary muscles.
Okay, weren't you going to talk a little bit about famous people having ALS?
Let's do that at the end.
Okay.
What does ALS do, Kevin?
ALS damages motor neurons, which are essential for muscle development. In other words, it affects your ability for your brain to talk to the muscles, if you will.
Which weakens the muscles and eventually causes...
I think they say later on that ALS typically ends in respiratory failure.
Right. Well, that's basically what they said.
A matter of just the muscles you use to breathe getting weaker and weaker, and your ability to breathe getting less and less.
Leads to loss of mobility, speech difficulties, and trouble swallowing and difficulty breathing is the ultimate end of your life. The early symptoms are muscle twitching, weakness in the limbs, slurring of speech, difficulty speaking and swallowing. And all of this is very similar to some of your symptoms that you had.
Which is also similar to early signs of Parkinson's and early signs of multiple sclerosis.
So anything that has to do with the neurons is very hard to figure out.
Anything dealing with the brain usually involves both testing and a combination of testing and observation by trained neurologists.
The progression is muscle cramps, stiffness, fatigue, emotional changes like inappropriate laughing or crying, cognitive decline in some cases. The later stages is being paralyzed and respiratory failures. The cause of this is really unknown, right?
Yeah, unfortunately, it is genetic.
Of only about 10%.
Yeah, it can be genetic.
Yeah.
But it's not like, here's the gene that causes ALS. It's more like if you have a couple of genetic markers, what they call genetic markers, you're of high probability of catching ALS at some
Not
point.
catching, but
having ALS
right.
At some point.
It's often linked to mutations in genes like the SOD1, and then there's several others that are. The risk factors include the most common age of symptoms occurring is between 55 and 75. Males have a higher risk before the age of 65. Smoking increases your risk. Exposure to environmental toxins also increase your risk, and military services, possibly due to traumatic or chemical exposures.
See, that's our problem. They named this disease partially after Lou Gehrig,
Right.
who's famous as a baseball player.
Right.
What else do you do this famous?
I don't know where you're going.
He married Marilyn Monroe.
I don't think that's the same one.
Same one. They didn't stay married. They're only married for a few years and they divorced.
Oh, okay.
But if, granted, Marilyn didn't have ALS, but had it been a female, not predominantly male, affecting males, if there were a celebrity like Marilyn Monroe, they could have associated with this disease. They could have raised a lot more money for research, I'm thinking.
Well, I think he was pretty famous.
He was, but as with all athletes, when they, retire and get out of the limelight, they tend to be forgotten easily.
The problem with finding out whether you have ALS is that there is no single test that, just like kind of like the ataxia that you have, there is no single test that confirms ALS. It's a combination of diagnoses involving neurological exams, like EMGs, nerve conduction studies, MRIs, blood and urine tests to rule out any other conditions. And there is no cure. No treatment is aimed to slow the progression or improve all. So your treatment is just to slow progression or try to improve the quality of life of the patient. Some of the medication is specific to a genetic help with the genetic mutation. But there's like therapy, physical, occupational, and speech therapy. There's nutritional. There is thought that nutritional counseling and breathing aids and assistant devices will help you with the symptoms.
Yeah, I think it's very important physical therapy-wise with this particular disease, since you're trying to delay the weakening of muscles. So it's important to keep exercising.
Right. That's what you were told all along is use it or lose it. Yeah. So I think that probably portrays to this also. The average lifespan after diagnosis is 3 to 5 years. About 10 to 20% live 10 years or longer. And I read another article, and they said a lot of it's based on your BMI, your body to fat ratio. If you have a lower BMI, chances are that it will increase your lifespan.
Yeah, for those that are not involved with tracking your weight, like Pompey's BMI stands for body mass index, just a basic breakdown of
height versus weight.
What's muscle, what's not.
Yeah,
etc.
It's just if you're more fit, it makes sense. If you're more fit, then you'll have a longer lifespan. The most common cause of death is respiratory failure. Preventing ALS. What we know so far is that the condition is currently no known cure, no positive method of prevention. So researchers are trying to identify several strategies that may help reduce risk or delay onset, especially in individuals with the genetic predisposition. Yeah, that's the word. Genetic and environmental risk management. You can take genetic screening for your family to see if you have a history of ALS, and try to identify the mutations on your gene. If you have those mutations in your gene pattern, avoid being, common sense. Avoid pesticides, heavy metals.
And for those of you that don't know what heavy metals are, a couple examples are lead or manganese. But that's not the entire list. That's just a couple examples.
We're trying to reduce physical trauma by, not being repeated concussions, spinal injuries that are linked to higher ALS risk. Wearing helmets, avoiding high impact activities may also help. Avoid smoking. That's probably the easiest one. It's known to have environmental risk factors for ALS. Nutritional and lifestyle factors. Kind of what we've always heard is eat your vegetables. Leafy greens, spinach, kale, broccoli may help reduce inflammation and oxidation stress, which is implemented in ALS progression. While there is no direct link between diet and ALS onset, maintaining a balanced diet and avoiding processed foods and toxins may support overall neurological health. So it's just basic health, being healthy. Again, BMI. Search and emerging strategies are biomarker tracking. Studies are undergoing to identify early biological changes that progress into ALS symptoms.
And that would potentially enable people to spot ALS before those symptoms occur that we talked about, which are common symptoms. Correct?
Right. So there's a whole bunch of other stuff. There is a bunch of studies that are worthwhile drug studies that are out there. If you're interested in it, all you have to do is research it. But let's talk more. Recently, there's been quite a few very public people that have announced or that we've found out that they've been diagnosed with ALS. Probably the most famous is the ball player that you just mentioned, Lou Gehrig. Yeah. And then Stephen Hawking is also a physicist that was diagnosed with ALS. He's since passed.
Roberta Flack.
Yeah. Eric Dane, and Stephen Gleason. Steven Hillenburg, which is the creator of the animated series SpongeBob SquarePants. So let's just take...
How about the astronaut, Sam Shepard?
Oh, yeah. No, I don't think that's the actor. There's an actor that played... I think he did play an astronaut, but...
No, Sam Shepard was an astronaut.
Oh, was he too? That was the actor.
Well, I think he was involved in the Apollo 13 moon mission.
But he's not the one that has the actor was the one that had the ALS. Yeah.
Couldn't tell you.
Yeah.
And like you say, I'm just reading.
So Stephen Hawking was born January 8th, 1942 in Oxford, England, and he died March 14th, 2018. Sorry. He contributed to our understanding of the universe. He worked on the black hole and the Big Bang Theory. He was also known for his theory that the black hole emitted particles.
Apparently, also, he had something to do with time travel.
Why?
Because he was born before he died.
January 8th, 1942, and he died 2018.
Yes, but you said the first 1918.
Oh, sorry.
Just a joke.
His cause of death was Lou Gehrig's disease. He became paralyzed, and he's famous for being seeing him in the wheelchair. He was diagnosed at the age of 21. His disease progressed slowly, and he was expected to live only a few years after his diagnosis, and he continued working for decades and became a wheelchair user because of his paralysis. He lived to be 72, so he was diagnosed when he was 21, and he lived until he was 76.
Yeah, I wish you were around that we could ask what he attributes that abnormal longevity to. Did he pay special attention to his physical therapy or specific physical therapies, or what have you.
Yeah, it doesn't say that.
It's not, with him not being around, you can't find that answer. You can only find what people think of, opinions.
Roberta Flack was born February 10th, 1937, and she died February 24th, so recently, 2025. She was diagnosed. She was, of course, a musician. It doesn't say when she was diagnosed. I think she's most famous for Killing Me Softly.
Oh, yeah. I remember that song.
Yeah. That's what I remember her by. Most recently, Eric Dane is an actor. He's 52 years old. He was diagnosed just recently. He's been in Gideon's Crossing and also on Charmed. He's best known for his role on Dr. Mark Sloan on the ABC medical drama Grey's Anatomy. He's Dr. McDreamy, if you watch that show. And he was just mostly recently diagnosed this year. He said one of his initial symptoms included weakness in his right hand, which he initially thought was just fatigue from texting. Other symptoms that he was experiencing that are common with ATLS include muscle twitching and cramps, slurred speech and difficulty swallowing, and trouble with daily activity like walking. He initially dismissed the symptoms until it got worse, and then he went to a specialist, a multi-hand specialist, and then a neurologist. And after 9 months of appointments, he was diagnosed with ALS.
Yeah, folks, one of the neuromuscular disease problems that you've got is they're so close together that it requires both testing and observation by your physician or neurologist. And so what that means is there's usually a period where, well, everybody certainly has something, they're just not sure exactly what it is. And then once they finish that period of their testing and observation, sometimes you can narrow it down even further with some genetic testing if you can afford it.
It was suggested to him that he manage his nutrition, and that it's nowadays it's vital, and they've researched that a diet rich in antioxidants and anti-inflammatory compounds would be beneficial to him. And he used the Cleveland Clinic is where he went and got all that information. So Stephen Hawking is the person that has lived the longest with ALS, and that was 55 years. They don't know why he lived that long. They don't know what he did to live that long. Like Kevin was saying, he contributed his longevity to aggressive respiratory support and maintaining an active lifestyle, is what he says. ALS is typically not a painful disease, but complications can cause pain. Progressively muscle weakness and twitching can cause muscle cramps and stiffness and strain from weak muscles, affecting posture and leading to discomfort. Also pressure sores because of the way you're laying, constipation, changes in diet and hydration due to swallowing difficulties can lead to constipation, which can be painful according to the target ALS. What is not a symptom of ALS is pain, numbness, or loss of feeling, impaired automatic function, like heart rate or gut movement. So doctors say it's a weakness, not a pain. My aunt, by marriage, had ALS. My Uncle Bill was just here recently visiting with us, and he was telling me that she lived 3 years after she was diagnosed, and it was rare that a woman would have it, but she experienced all of those symptoms and eventually passed away due to respiration. She just quit breathing.
It also says that based upon your genetic markers, they've had different drug trials that showed up to a 50% disease progression of early results. So, in other words, during their trials, which are not completed yet, they're still in the early stages, they estimate that they have a 50% reduction in disease prevention, which is, I guess, good news if you have ALS. Okay, what you can do to explore a bit more or contribute. Okay, I'm going to, there are two different topics here. Learn a little bit more. Obviously, there's a lot written on the internet about ALS. And I guess the main site is als.net. And that'll give you the most up-to-date information. Stanford University runs a database of people with, well, it used to be rare diseases, but I don't think it's necessarily rare anymore. So, for example, if you've had ALS and you're at a certain point, they may want you for a clinical trial about some of the ongoing treatments. I don't think they're necessarily all confined to rare diseases. And those can range from actually going to a clinic or a hospital to conduct say a drug trial, or it can be as little as, here, fill out the survey, we'll email you a copy. It's not always as invasive as packing your bags and going to a university somewhere.
And there is a ALS association that you can get more information from too. So I think that covers it. We definitely have learned some stuff about ALS, and there is probably more stuff to learn. I'm hoping that maybe we can find somebody that we can have a conversation with that either had a relative or knows a little bit more on a personal level.
I would like that very much. I personally don't know anyone with ALS, though.
Yeah, I don't either. No, I mean, we asked my Uncle Bill, and he was not interested in doing the podcast. So,
no, he doesn't have ALS, though, does he?
No, I mean, my Aunt Shirley.
Macular degeneration.
Yeah, but I asked him about the ALS for my Aunt Shirley, and he didn't want to do that one either. So, okay. Do we have any?
Yeah, we have a little bit of housekeeping. This is the end of October, and this will be the last podcast for October. The next one will be our last podcast for this season. So if you're interested in joining the sweepstakes for our end of season giveaway, which is a piece of art that we will ship to you, you need to get on our website, whenlifegivesyoulemons.net, and support our program. financially. We're looking for a one-time minimum donation. Every time anyone uses fan mail, we'll give them a free shout out. But just be warned, sometimes people who reside outside the U.S. are not eligible to use fan mail for free. Taxing charges may apply. So if that's the case, you can always email for me. Let me know that you would have used fan mail, but that was going to be a cost to you. And I'll give you a shout out, and we'll make sure that we look at that just like a fan mail type situation. So that about does it for this week. Remember, our next podcast will be our last one. That will be on the 5th of November. And we're going to start back up in February. So until next time, folks, see you later.
Bye now.
I'm sorry, folks, I misspoke earlier. Lou Gehrig did not marry Marilyn Monroe. He married Eleanor Grace Twitchell Gehrig, who was basically the love of his life and supported him through all his ALS struggles.
And she was instrumental in getting the ALS named after him. And she started the ALS group up after he had passed.
I was going by a movie and not the facts. I'm sorry about that.
Live and learn.
Till next episode, take those lemons and make your own lemonade.